In this video, we shall learn about what to do in case of fire in a medical care institution. It is important that you know what to do in case of emergency. Remember to ask from your supervisors what to do in case there's a fire alarm. Fire causes a lot of smoke. In this case, the TV starts to smoke before it catches fire. When the smoke reaches the detector, fire alarm goes off. Sometimes smoke detectors can also react to heat, steam, or dust. Two nurses are in a different department, and the third nurse is alone in her office. If there is a fire alarm, stop what you are doing and stay calm. Find out where the alarm is coming from by checking the fire alarm system console. Fire alarm system's screen and the related map of the building will tell you where the alarm is coming from. Make sure that you know where the fire alarm system console is located at your workplace. Ask from your supervisor how the fire alarm system works at your workplace. Remember, practice makes perfect. Start by touching the door with your hand. Is it hot? If the door is hot, do not open it. If the door is not hot, you may carefully open it. If there is only a little smoke, help the patient out of the room. If the patient can't walk by himself, you may move the patient by pushing the bed. Remember to remove the electric cables connecting the bed to the wall. Make sure you know how the bed works and it fits out of the door. If the bed does not fit out of the door, use the rescue blanket. The rescue blanket is already in the bed, tucked under the sheets. Close the door behind you so that the toxic smoke won't spread. Move the patient to another fire compartment. Building can have many different fire compartments. Fire compartment slows down the spreading of the fire and toxic smoke. If patients come into the hallway, take them back to their own rooms or to another fire compartment. If the fire has not spread, other patients should be waiting safely in their own rooms. If the fire spreads, the patients need to be taken to another fire compartment. Test with your hand if the door is hot. If it is hot, do not open the door. If the door is not hot, you may carefully open it. If the room is filled with smoke, Do not enter. If you go in the room to put out the fire, remember to stay low and do not breathe the smoke. If the fire starts from electric appliance, carefully try to remove the plug from the socket. After putting out the fire, exit the room and close the door behind you. Call 112 and tell them what happened. Important. Other patients don't necessarily need to be evacuated all the way outside. Make sure you know where to find fire alarm system console at your workplace. Are there several consoles, or do you have a system that also sends alarm to your mobile phone? What are the fire compartments in your workplace? What doors are fireproof doors that should always be closed? Where can you find extinguishing equipment like fire blanket, fire extinguisher, and fire hose? Participate in safety walks at your workplace, read the rescue plan, and learn about fire safety in your workplace. Practicing beforehand will help you in case of emergency.